Hi, it's Cheryl Lyons, hiding under the blanket from my granddaughter. She is super attached to me and wants to be in my business all the time, which that's going to change when I start working. I want to talk about my lung transplant journey. To get diagnosed, they did a CT scan. I had interstitial lung disease. And you hear the cartoon she's watching. Hopefully, she'll stay busy. Um, so, when I first started noticing my problems with my lungs, I was having trouble going upstairs. When I went hiking, I was out of breath really easily. And I thought, this isn't normal for me because I used to hike a lot of miles. So in March of 2020, I was diagnosed by Dr. Dr. Gosine, that I had interstitial lung disease. He referred me to the transplant clinic at Traeger Transplant Clinic in Louisville, Kentucky. And Dr. Ramirez took over. Dr. Fox and Ang did my surgery, so I was told. And the night I got the call, I was going to bed. It was about 10:30 at night. And they called me and said, "We have lungs for you." And I got really excited and I told Joey to wake up. It's time for my lung transplant. I took a bath. I got ready as quick as possible. And we went to the hospital. I used to cough all night long. Now I don't. So, thank God for my transplant. So what happened is after the surgery, several hours of surgery, they came out and told my husband that they had to go back in because there was a bleed. So I had another 5 or 6 hours of surgery to fix the bleed. So I had double the dose of anesthesia. Excuse me. I cough like this after dialysis, so don't be alarmed. It'll go away. They said it's something about the way my lungs handle the shifting of water. So I always get a cough and I get short of breath. Then it goes away. So after they fixed the bleed, I was in ICU for a while. It was a big adjustment that I had to have other people wipe my butt. I had to have a feeding tube. I had a tracheotomy, so I wasn't able to speak. And I was on the vent for a while. The ventilator. I was really, really miserable. I felt like I had trouble getting enough air. And they said that was normal. But I really panicked a lot. That I couldn't breathe, that I couldn't get enough air. Just being so vulnerable was really hard. If I wanted to speak, well, I couldn't speak for a while because not just the tracheotomy, but I was so sedated that I slept a lot. They would wake me up and get me out of bed to walk. They would follow me with a chair. I used a walker. I had 2 staff members help me. And I'd walk a few steps, then sit down in the chair that they followed me with. And I wasn't able to walk very far, that's for sure. But every day they had me try. And eventually I was able to make a full round in ICU. It was so hard. I remember the struggle. When they finally moved me to a regular room on the 3rd floor, I started rehab. Rehab was 3 days a week, and that's pulmonary rehab. I would have to walk a mile or walk around one time, do some weights, do the bicycle. Eventually, I was able to do a few stairs. I was able to walk twice around, and I was able to take on heavier weights. But I did the rehab a year and a half. So that's 3 days a week. After my surgery, my kidneys shut down. They said it was the trauma of the surgery. That doesn't happen to everyone, but it happened to me. It shut down, or they shut down, and they never came back. So I'm still doing dialysis to this day. I had the transplant in November of 2022, and I still have no kidney function. I was on the list for kidney transplant, but they took me off because I kept getting sick. I had pneumonia twice. I had a UTI once. I had an ear infection another time. And this is all within a 6-month period. So they took me off the list. Well, I've been healthy since February, since they started giving me breathing treatments using meropenem, which is an antibiotic. I take those 2 days a week, twice a day for 2 weeks. Then I'm off for 2 weeks. Then I do twice a day for 2 weeks, and then off 2 weeks. And this is for the rest of my life. But it's really helping. I've been healthy since February. I've gotten a lot of my energy back. I've joined the gym. And thank God I won the contest and don't have to pay until the first of the year at Anytime Fitness. So I was really happy about that. I was in the hospital for 3 months. That includes about 6 weeks of rehab. Then the rehab had to continue for another year and a half. I did some exercises on the floor, walking around the unit, doing some weights, using retention bands, and believe me, it was a struggle. I hated it. I didn't want to do it, but I had to. If I wanted to say something, I had to write it down on a whiteboard. And it was really hard for me to write because my hands were shaky. While I was getting adjusted to the meds, my complexion changed and looked awful. My hair started falling out, and I kept shaking, and then I would also bite my tongue while I was asleep. So after they adjusted the meds, I was better. But my tongue was really prickly and dry. It was just awful, an awful experience. But hey, I'm still alive. I've been able to go to family functions. I've been able to go on vacation with my loved ones. And now I'm starting a new job next week. So I've made a lot of progress. I'm very proud. My husband has been wonderful. He's done a lot to care for me. He's given me baths. He's wiped my butt. I also had some sores. I had a bed sore on my tailbone, and then I had a sore on my right hip that had to be packed or dressed twice a day for months. I mean, like 8 months. And that occurred after my surgery. I became septic and almost died. They gave me 3 different antibiotics and pulled me out of it. But they had told my husband that I may not make it. I don't remember any of it. I was so out of it. But I'm glad I made it. And after I was septic, I got those huge blisters. And that's what they had to dress every day. It eventually popped, but the sore, the wound that it left, had to be dressed twice a day for months. It was horrible. But my husband dressed my wounds. He helped me walk. Had to use a walker for a while. Used a wheelchair sometimes. Eventually, I was able to walk on my own without the walker. I was so glad. I didn't like using the walker. I didn't like using the wheelchair. But it's something I had to do for a while. So if any of you are planning on getting a lung transplant, feel free to reach out to me on Facebook or here on YouTube. You can help me, and I can help you get through this. If you have any questions, please don't hesitate to ask. I'm still hiding under this blanket, and so far she's left me alone, which is a miracle. I love her. She's attached to me, 5 years old, and full of energy that I wish I had. But thank you for listening to me. I'll be making more videos. Please like and subscribe. I'm on Facebook. Like and subscribe me there. Thank you so much. It'll help me a lot if you do. My medications are very expensive. Luckily, I reached my deductible, so I don't have to pay as much. I'm paying like $60 a month, where I was almost $400 a month. I thank you to all those who have helped me and supported me and cheered me on. Thank you to all the ICU staff and everyone on the 3rd floor. They took really good care of me. I love you guys, and I'm done with this video. Thanks. Bye.